Hello, hello, good people. Welcome to Healthy Mentality Live. Thank you for joining us. I got a great panel here tonight. Most of you should know all of these young men, and I value their input on the discussions that we're going to have tonight. Before we get started, I just want to throw out there that I am not a medical provider, neither are any of my guests. We are not offering medical advice. We are just offering our perspectives and our experiences. A few housekeeping items. The I put out a video, I think a week or so ago, because I was running out of men to interview. No one wanted to come on, and I had a great response to that video, and I got a lineup to hit y'all with. Taking next week off, but on February 24th, I'm interviewing a young man named Gary. And then I'll be back on March 3rd with DJ Don Juan from Chicago. And on the 10th, Mr. Ben will be joining me. And on the 17th, I'll be taking that off because I have a business trip. And then on the 24th, TT Trucker is going to be joining me, jumping on and telling his story. And on the 31st, heavy on the jumps. Found him on YouTube. His transformation is amazing. The guy is ripped. And on April 7th, I'll have Kevin J. And I have some other men after that have not confirmed yet. But I think I'm pretty much booked through April now. So we got some men willing to jump on and tell their stories. And I'm looking forward to hearing it. And so if you know some men out there that want to jump on, please have them holler at me. My email is on my link and my channel page and my link tree as well. And if you know someone that wants to listen to these stories, please give them my channel page and tell them to join the chat when we have these live interviews on Tuesday nights. With that said, I am going to bring my esteemed guest to the stage. Hello, man. Welcome.
Good evening.
Hello. Good evening.
Thank you for joining us. Before we get started, I know none of you guys need an introduction, but if you want to go ahead and introduce yourself, starting with Grant.
I'm Grant Campbell from West Virginia. Been on GLP-1 for about a year. Glad to be here with you, gentlemen.
Thank you, Grant. Thanks for joining us. And the man himself, Paul on wheels, or I'll call him Paul Wall.
That's me. What's going on, everyone? I am Paul Amadeus Lane, Paul on wheels, Paul Wall. I'm delighted to be with you. My shot anniversary is February 14th. Been on the GLP-1s since February 14th, 51 weeks. So, yeah, great to be here. Thank you again, the GOAT RMZ, for inviting us.
All right, don't start that now. Y'all gonna make me blush. Come on now. Thanks for joining us, Paul. And G's 101.
Welcome. Hey, for those that don't know me, it's G's 101. I've been on my journey a little more than a year. I'm down 29% of my body weight, and I'm, rocking and rolling. So if you want to, meet me on Sunday evenings over on G's 101, all are welcome.
Thank you, G's. And the messy middle, Mr. Dariam.
Hi, it's the messy one. I'm sorry. It's Dariam, and what's up, everybody? I'm really an apparition, so I'm not really here, but
it's AI.
I want to make sure that everybody, I'm just kidding. So I'm somebody who is trying to find what it's like to live a full life on a GLP-1, and every day is different, and I'm here for it.
Absolutely. I want to thank you all for joining us. All right, so first before we get started, is there anyone that has a non-scale victory for the week that they want to mention? Paul, I know you got one because you told me earlier. I know you got one, Paul. But Darian, right. You raised your hand, so you go ahead first, Darian.
Yeah.
So my non-scale victory is every day this week I got out of bed pain-free.
Love that.
And that's a blessing.
That is a blessing. Love that. All right, Paul.
All
I
right.
don't, did you want to hold? Did you want to hold this back for your video or?
No.
Okay.
I'll go.
All right.
I'll go and let it out now.
All
But
right.
I text RMZ this morning because, as you all know, I got denied my zepbound coverage. So an interesting thing happened yesterday, and this was after I spent over $1,200 on my compounded 6-month medicine that I have. Got a call from my insurance company, and they was like, "Give us a call. We have an important message." So I was like, "Let me just go on my app and see what they're saying." So I go on my app, looked at my documentation, and I saw this green box that said approved. So my non-scale victory is now, I am now covered for my 10 milligrams zepbound until 2099. That's how long my prescription is good for, my authorization is good for. And they saw that my AHI from my sleep apnea went from 38.7 to 8.8. And my medical team was like, if you take him off of this and if you don't improve him, that is going to come back. So I have 3 boxes I picked up yesterday, got 6 months of compound. So it's all about stacking them chips now, player. That's what I'm going to do now.
Yes, sir. Love that. Love that.
That's amazing, man. Congrats.
Thank you.
Anyone else?
I'm just like Dariam, getting up every day, keeping up with my daughter a lot better than I used to. So, amen to that.
Love that too.
Well, I
Jeez,
feel
you got
like
one?
my non-scale victory is still being able to go to like any store now and just purchase stuff off the rack. I thought I would actually get used to it, but I'm still like it's still like surreal that I can go in and just buy things off the rack because I've been buying stuff online for so long. So it just saves me so much time. So I'm still reveling in that. I'm still loving it.
Yeah, I love that.
Yes.
Now, myself, you guys may remember that I did a video, my health update, a week or so ago about my back and my shoulder, and I got in with both doctors, so I won't need surgery as of yet. So that's a good thing. Just more physical therapy, and my back they're going to do some facet injections to do some diagnostic to see where the pain is coming from. So no surgery, so I'm loving that. So that's my
Good.
non-scale victory for the week.
That's good. Good news.
Yeah. Now, as I was preparing for this, I was trying to find what we could talk about, and I was scrolling through Instagram last week, and I came across a video from Kev on Stage, and it fit perfectly into what we're trying to do here. We're trying to make it comfortable for men to have these discussions out in public with each other and their friends group and their families, and talk about their health openly and take it serious. And so I want to play this video and get y'all's reaction. Oh, just a second. There we go. Guys there? All right.
My annual physical today, so I tweeted that and said, black men go to the doctor. And some of these responses are a lot. It got fingered and trying to tell us to go. Wow. I don't think you know what happens at a physical. Nope. Stay healthy by constantly working out, eat right, and be active. He said nope to going to the doctor. You should work out and eat right, but also getting an annual checkup is okay. You could have just said men go to the doctor. Smish. I'm a black man. Black men traditionally have a higher rate of not going to the doctor compared to, women in other races. So I'm a black man talking to black man. That's why I say black men. Go to the gym, then you can avoid the doctor. Again, no. You can't screen for heart disease and cancer and things like that at the gym. Okay? I'm not saying don't go to the gym, but like, You can do both. Did you tweet this with a finger up your butt? Okay. Annual physical doesn't require fingers going in your butt. I think a lot of men don't know this because there's a couple responses like that. They do blood work. They check your pee, your vital signs. They ask you about your mental health. Sometimes an EKG, check your lungs, things like that. You talking about a rectal exam? That's for prostate, and that doesn't happen usually till you're between 40 and 45. I didn't say that. Okay, somebody responded under that. You can almost hear the moans as he's typing. Are y'all okay? It said go to the doctor in America. Lymphao. Sure, let me take out a small loan of $10,000. Okay, even without insurance, an annual physical is somewhere between $100 and $350. So not exactly cheap, but also not $10,000. Kev got finger bangs. Have y'all ever had an annual physical? This is a common comment. I need to know what y'all think happens, because it's not what happened to me on a Saturday morning. No, eat healthy and work out and take herbs, not genetically modified, made chemical drugs that doctors prescribe you to take. Cool. Just put a finger in his butt, no spit. Now he don't want to be alone. Is everybody okay? Is everybody okay? It's a scam. I'm good. Do you though? Somebody basically said, no, that's why y'all be dropping dead. And he said, I won't. F them con artists. God got us. And to end, I was called racist. You know what? Don't go to the doctor. Don't go. It's your life. It's your life. Do whatever you want to do. Do what you want to do.
I was so fat and nasty.
What's y'all's thought on that?
That's a lot, man. That's a lot. It sounds like a lot of young ignorance. I really feel like a lot of times you can't see who behind the screen, but there's a lot of kids and young-minded people on the internet, and I feel like a lot of that, with us not being able to see who's saying that, it's a lot of trolling. You know what I mean? I'd like to believe that, just talking to like employees and people that are around, they're not that ignorant. You know what I mean? So the average person knows that when you go to the doctor, you're not just, going to get, a rectal exam. They actually do, draw blood, and, some of these, young people and stuff work at these places. So I think they know better, but there's a lot of kids trolling, and the ones that were serious, you can only just pray for them.
Yeah, definitely. I think there's some trolling aspect there, but in the conversations that I have with a lot of men, that's the perspective that they all have. I know a lot of them won't go get a prostate check because they think it's going to be a digital rectal exam instead of a PSA. So how do we fight against that kind of mentality and educate people that, it's more than a doctor sticking his finger up your butt?
I think a lot of what probably needs to happen is more people telling their stories of, I went to the doctor today and this is what happened. Kind of taking the stigma of what happens in an exam and making it more clear. Because a lot of fear-based things, I've told myself, not those particular things, but I've given myself more fears about why I should not go to the doctor, or why it's a wasteful to go to the doctor. Even something as simple as, I don't want to get on the scale, as a reason not to go to the doctor. So any excuse will do to keep you from doing things. And sometimes you have to go and you have to do it scared. So a lot of the things that he was saying, I agree, Jesus, was a lot of trolling, but it was also a lot of serious things, because I have heard those types of things, or even I can't afford to go, it costs too much, and all of that. And also growing up in the neighborhood I did, the only doctor that a lot of people saw was going to the emergency room.
Mm-hmm.
Where it's way more expensive.
Yeah, Dariam makes a good point, trying to go into the process of it instead of just saying, oh, you should go to the doctor. Mm-hmm. And I'm not trying to generalize all men, but I think it's common that if men are preached to, they're going to shut down and say, forget it. I ain't doing it. You gotta show. You got to be an example of what you need to do. You don't just say you need to do it and preach at them. You got to show it.
And Grant brings up a very good point. And us men got to get over that not wanting to be preached to, because that done got a lot of dudes 6 feet under. That machismo kind of mentality, and just grow and evolve to the point, like, if somebody is this adamant about keeping me healthy, keeping me safe, then I need to look into it. I need to swallow my pride, go and check it out, because it's bigger than me. This is my family, this is my career, this is all this, and then learn from it. And like what G said about all these trolls and everything. But the interesting thing about it is people agree with that stuff, and that blows my mind. You can see who these people are, and sometimes it's your friends commenting on it, and you're like, wow, I didn't know they was crazy like that. But it just shows, man, it's time to change the narrative. And I'm glad that we do panels like this, because we tell the men folk out there that it's all right to get this done, man. It's all right to try to get your health together, because if not, what's the alternative?
And I guess to echo that, Paul, I feel like the other side of it is, he said, what can we do about it? I think we're doing it right, because we are the example. Our health journeys, us, me taking the time, to get on the airways every week and go through, my entire medical, diagnosis line for line with people, really kind of is what that is. You know what I mean? That's showing them that that's not what it's about. These are the things that actually happen and what could happen, and then putting photos up of our before and afters, and having these panels and these conversations. These are the things that are necessary, because we're live and live in color, and we showing it, and you can see it, with the people around you and the people that's on the airways and the people that's watching right now. So I think we're already doing it.
Grays gets the comment of the night so far.
Yeah.
Grays is amazing, because the stuff that she comes up with, it be sick burns, man. I mean, you could tell Grays hung out with all the homies in school, because her sick burns are pretty sick, man.
Yeah, we got to find a way to combat that, because there are some dire consequences on the other end of that if we don't take our health seriously, and we'll get into some of the numbers around that a little later. All right. I know you guys all probably watched the Super Bowl and saw the commercials. There were a few commercials that stuck out to me, but it may just be me, but I remember commercials used to be good when I was coming up. I have not seen a good Super Bowl commercial in years. But there were a few memorable ones that stuck out to me, and one was the Mike Tyson one. One was the PSA one, the tight end, and the other was the Wegovy, I think it was. But I want to play this Mike Tyson one, the Maha commercial, and get your thoughts on it.
I would eat anything. I was like 345 pounds. A quart of ice cream every hour. I had so much self-hate when I was like that. I just wanted to kill myself. We're the most powerful country in the world, and we have the most obese, fudgy people.
There's a lot to be said about this ad, not least of all the fact that decades of data have shown us that moralizing food and shame-based messaging, like using the terms fat and nasty or fudgy people, whatever that means, are not helpful. This is well established. Shame and stigma-based messaging around diet do not improve health behaviors and are consistently linked to worse eating patterns, disordered eating, and poor mental health. But what I really want to focus on is this line.
Something has to be done about processed food in this country.
This aired during the Super Bowl, alongside commercials for Dunkin' Donuts, Lay's potato chips, Michelob Ultra, Pringles, Budweiser, Pepsi, Skittles, Hellmann's mayonnaise, Ritz crackers, tortilla chips, and Raisin Bran. If we are serious about improving how Americans eat, we have to start with reality. Americans do not struggle to eat well because they've not heard enough shame-based messaging. They struggle because we built a food environment designed for profit, not health. Highly palatable, convenient, aggressively marketed foods dominate our landscape because they make industry a lot of money. Meanwhile, more healthful foods are far less accessible for millions of people. This is not an accident. It's the predictable outcome of policy choices and an unwillingness to meaningfully regulate powerful industries. And more broadly, health is largely shaped by income, food access, social supports, environment, and access to education and healthcare. These are the forces that determine what people are realistically able to eat, and you cannot shame someone out of structural constraints. If we truly want people to eat more nutrient-dense foods, shame-based messaging during a football game is not the solution. It requires building a society where the healthier choice is the easier, more affordable, and more accessible choice. It requires policies that strengthen the main drivers of health and willingness to rethink systems that currently prioritize corporate profit over health. Until that happens, food manufacturers will continue producing and aggressively marketing the food that generate the greatest profit, and people will continue to eat what is most available and accessible to them. And this MAHA movement, which protects industry while promoting anti-science agendas and stigmatizing people trying to survive in a profit-at-all-cost system, is doing real harm and is certainly not making America healthy.
Black men.
Wow.
What she said.
Right. I was gonna say that too, Paul.
Yeah.
She nailed it, didn't she?
Yeah.
She nailed it.
Yeah.
And the funny thing is, someone in her comments, I think it was her comments, either her comments or Dr. Nagalski's, because he did a video as well, mentioned that if you scroll down Mike Tyson's IG like 6 months back, you see that he's promoting a fast food restaurant. It's plant-based, but it's fast food, and plant-based fast food is ultra processed food. And now he's doing a commercial about not eating ultra processed food. So, and not only did he do all the things that she mentioned, but he's also hypocritical in his stance as well.
I'm gonna say this, yo, that was our tax dollars at work. We paid for that ad, and that's what that ad. How much they probably spent over $1 million and some dollars, probably more than that on that ad. And if he ate a quart of ice cream every half hour, dude must have had some bubble guts, man. Because if I have that much ice cream, I got to go to the bathroom, man. It's, I guess it bothers me because people think we that stupid. I mean that we okay with that. I mean, fat shaming, and what they do is they slap a prominent person of color athlete on there and say, "Oh yeah, everybody's gonna like this because we have everybody on this." And I'm like, y'all think we that dumb? And it makes me mad, man.
Yeah, Mike did a Good Morning America interview, and he claimed that a friend of his from 40 years ago reached out to him and said he'd be the perfect person for the ad. And I don't know why, but they chose him to do it. And he went into about back when he was over 340 pounds and all that he did to get the weight off, and the fact that he still suffers from obesity right now, and he just super disciplined, and telling people that they should just, even during the Super Bowl, eat healthy and so forth and so on. But I mean, you can take it with a grain of salt, with whoever set that up. They might even coach that interview.
Yeah, and to your point, Paul, I looked into, because I thought the same thing. I saw the Eat Healthy or realfood.gov or whatever. I thought it was a government commercial. Thankfully, it wasn't our tax dollars. It was paid for by the MAHA company or whatever that is.
Make America healthy again.
Yeah. Well, I forget it's MAHA Corporation or something like that.
Okay.
Yeah. But the commercial cost $8 million.
Wow.
Well, they certainly didn't spend the money on the writing. Yeah. Because he came in with so many different things. He talked about obesity in just a flippant manner. I mean, now, I don't know what his eating habits were, but, I'm sure that he has had some. But there seemed to be a false equivalency between what you did and getting the weight on and eating an apple at the end.
Yeah.
What's the process? What are you even saying? So it was somebody who probably, well, I don't know. This is just me theorizing. It sounds like somebody cut together and spliced together something that seemed, I want to mince my words properly, um, a little contrived in their messaging and making it sound almost buffoonery
Yeah.
Mhm.
and
I
trying
know
to
I know
send
where
a
you're going
message
there.
by ridiculizing one of the black public figures in a way to send some kind of agenda across.
Yeah, and they use Mike Tyson, so I mean, you you know what I mean? Like that says it all.
And
That's
here's the hypocrisy. We just got a new uh food pyramid, which I'm down with a lot of that stuff in there. I think we should be prioritizing protein and all these things. But then you got him eating an apple and no protein. So I'm like, what's the message you're trying to send about how to lose all this weight? Eat apples every day,
he
So that's just
Mike
kind
Mike
of
Mike is
confusing.
vegan, so
Oh, that is true. That's
yeah.
true. Yeah.
Yeah.
But the the biggest concern is that it's casting obesity as a moral failing and putting out there that you're not good enough because you're obese, because you live in this bigger body. So you got to just kill yourself, and if you don't want to kill yourself, then you need to eat this apple type thing.
Yeah. And they layered it with his sister dying of a heart attack when she was in her 20s. But when in fact, we don't know for a fact, and I doubt if he even knew back then, if it was a pre existing heart condition or
Mhm.
actually, in fact, obesity.
Yeah,
So,
that too. That too.
But I
All
say,
right.
give us the $8 million. We can do a better commercial spot. Y'all want to petition them? Give us the 8 million. We can hook it
Yeah.
up.
And I
and
wonder how
the first
much.
commercial I saw was zepbound. That was the first commercial I saw when I turned it on. I streamed it on Peacock, and the first thing I saw was zepbound.
Wow.
And it's $8 million for the spot, so I wonder how much he got paid for it. So
Mm,
I'm sure he got a pretty penny out of that too.
no doubt.
All right, so my favorite commercial. This one is near and dear to my heart. My guy Dariam texted me when this commercial came on. So, but I can't play the actual commercial. It's going to play in the background while this doctor is talking over it because I don't want to get a copyright strike.
Right.
But to set it up, it's featuring a lot of great all-time tight ends, football players, and it's them loosening up their tight end because they don't have to go to the doctor to get a digital rectal exam, or as those on the Kev on Stage video were saying, get a finger up the butt type thing. So
How was the best Super Bowl commercial about prostate cancer screening? Let's talk about it. Prostate cancer is the most common cancer in men. It affects 1 in 8 guys. Yet so many men still avoid getting screened. Why? The rectal exam, that finger in the butt. For years, prostate cancer screening meant a PSA blood test plus a digital rectal exam. And let's be honest, the fear of a finger in the butt has kept a lot of men out of the doctor's office. Uncomfortable for some, straight up traumatic for others. Guys just don't want to get it done. And the data backs this up. One study showed 100% of men would get screened if it was the PSA blood test only, but that dropped down to 78% when the rectal exam was included. Here's the good news. The AUA, the American Urology Association, updated their guidelines and now says the rectal exam is not mandatory for prostate cancer screening. That's right, no more finger in the butt, just a simple blood test that can do the job. So tight ends, butts, and honestly my fingers can all relax. The question then becomes, when should you start screening for prostate cancer? If you're higher risk, that means black men, having a family history of prostate cancer or a genetic mutation like a BRCA2, you start at the age of 40. For everyone else, you start at age 45. It's easy, it's quick, and it might just save your life.
Hmm.
So, of course, that one is near and dear to my heart. And uh, I just had my blood work done for my PSA, and it's still low. I'm at 0.4, so well below the threshold of 4.5. My radiation treatment did its thing. I'm about a year. I started about a year ago. Was when I started my radiation treatment. So all that is holding on. But this is one thing that a lot of men don't know about. You don't need to get a digital rectal exam. You can go and just ask for a simple blood test, and if you have medical insurance, it's going to cover that test for free. Just like I think women get their mammograms covered by insurance as well. So ours is the PSA test. So I would highly advocate any man out there that hasn't gotten one, especially if you're a black man, because and I say that because black men are 80% more likely to get prostate cancer and twice as likely to die from it. And part of that dying part is because we don't get checked until it's too late. We should start getting checked at the age of 45. I didn't get checked until I was a few weeks before my 50th birthday, and I had no idea that I needed to get checked. And thankfully, they caught it in time. But so I'll turn it over to you guys so you guys can speak on it if you want.
Well, I would like to. I mean, most people that watch my channel know I turned 45 a few weeks ago, and I echo that sentiment. And I'm grateful. You know, I also had all my blood work done, and I came back good. So and I've been telling everybody that I know about it. You know how simple it is now, and to please follow up and get it. I did a video just this other day talking about the other tests. All my cancer screenings came back great, and I only have the colonoscopy and the heart ultrasound left to go. So if you have not, please go ahead and get yourself tested, because early detection is key. Like Charles said, if you get things checked out, it's just as simple as that. They can start working on it early, and you can have successful outcomes. Waiting is the worst thing you could do. So
Another thing men like to do is go by the saying, ignorance is bliss. This is not the case on any of this, especially cancer screening like that. Ignorance is not bliss.
And geez, I'm glad to hear that you got your test and it came back good.
Yeah.
That's awesome.
Absolutely.
That's awesome.
sir.
Yeah, that's awesome. And Charles, you the GOAT, man. So we love hearing all these positive things, man, about your journey with it. And I know, like with me, I was happy when they can just check the prostate with blood. For me, trying to get a prostate exam the old school way, I mean, it was like a miracle trying to get that to happen. They would have to transfer me out my chair. They would have to turn me over. If I had a muscle spasm, I would like hold my doctor's arm hostage because my legs would tighten up and stuff just for involuntarily things. But I'm glad that the test is really more accessible now and even easy. And I think the more we talk about this, we can get guys make sure they get it checked, because like G said, early protection. I mean, that's the key.
Yes.
So what I'll say on this, on a personal note, so when RMZ went through it, and this is nothing that he hadn't heard before, going through his particular journey and all of those things really sparked me to make sure that I did the same. I had, shucked off not doing it. I was like, okay, I'm thinking this and that. But since he went in and implored everybody to do it, my next exam that I've done it and have continued to do it, and him sharing his story demystified a lot of that for me. And in that, I have shared that story with many of the other men that I know. I mean, I don't know who's going to get prostate cancer. So every man I know, I tell them, hey, get your PSA done. It's a simple test. Get your PSA done. And if they have questions about it, I should share your story, RMZ, because I wanted them to humanize what it is. It's not just a PSA. Oh, it's not just a public service announcement instead of a prostate exam, but it's an opportunity for people to see that this is a real thing. There could be real consequences, and some of them you can be very, very successful on, but you want to make sure that you take it seriously, do the test so that you know.
Yeah. And for those wondering, the screening guidelines are generally you start screening at 50 unless you are a black male or you have a family history. And family history is you have a father or a brother that have it. Then you should start getting tested at 40. If you don't have that, then 45 is the age that you start getting tested if you're a black male. And it's very quick and easy. All right, next topic. This one might set things off a little bit because, and I want to say this. I'm not passing. I should say we. I don't want to speak to everyone, but I'm gonna say we are not passing judgment on anyone that partakes. But we want to talk about the gray market a little bit.
Mm-hmm.
And it came up a few weeks ago on one of the lives with my good brother, Bound. But it's not him. But if I scroll TikTok, my TikTok feed is filled with men mostly, and a lot of black men mostly that are in the gray market and promoting it, either on live or doing videos about it. If I open a YouTube video, without fail, the first commercial that comes up every time is a peptide commercial. And so I want to get y'all's thoughts on this. I'm kind of curious about what the cross section is between those that are in the gray market and those that refuse vaccinations or going to the doctor or getting screenings and all of that. What do you guys think about it?
Well, you mentioned it, so I will too. I mean, it was after that live, Charles, that I got very concerned even more. I mean, I was already concerned about the gray market, but then when I heard all that, I'm like, whoa, this is a bigger problem than I thought. And, I think I did that downsized interview about 2 days after that. And at the end, you may have heard me say, it is important, so important, to never start any medications, any supplements for the most part, without your doctor's guidance. I mean, that's my stance on it. You cannot. It's just too dangerous. You don't know what's going to interact with what. I mean, I'm on blood pressure medicine. I mean, what if this other NDA plus I decide to take on my own is going to react in a bad way with what I'm already taking? I could get on and on about this, but it really frightened me, and it concerns me about how big this gray market is getting with people using all these medications and all these supplements without a doctor's guidance through it all.
I agree.
I mean, I probably could say a lot, but I don't say too much because I did do a video after that, and my man Bound, cool guy, he was in it too afterwards, and I talked to him a few times, and my thoughts on it is that people are going to do it, right? So if you are going to do it, at least try to make sure that what you're purchasing you get analyzed, because you can send it off and have it analyzed for impurities, which is an extra step that most of the people we talking about via TikTok aren't doing. But the guys that do should take that extra step. I would say, suggest most people that watch me know that I'm not for anything gray market, black market, anything not regulated, in the to the best of in the best manner because it's your health, and you definitely don't want to be taking those risks. But like Grant started out, number one, you definitely want to be honest with your physician, because if you're not honest with your physician, you're going into an appointment looking for help, and you having someone guide you under false pretense, right? So, there's a lot at stake there, because they're actually prescribing you things and guiding you in a way, thinking and believing that you're listening and under their care and listening to them, and in fact, you're doing things that they don't know about. And if you have an adverse effect and you end up in the ER, or you're unconscious or something like that, they won't know where to start. So I implore anybody to please, be honest with your physician, number one, even if you are using something like that, so that way they know how to treat you. And then, if nothing else, if you are going to start utilizing medication, do your research, try to study what it is that you're doing, because you don't want to be doubling down on these different peptides, and not knowing what's involved or what's in them. If you're going to be on injecting yourself with something, at least do the research.
Right.
I checked into the process of getting some of those medications, or gray market stuff, and you can easily purchase them online. There's no checks or balances on it. You just go to a website, but they all over the site they have these pop-ups that saying, "Do not inject these." So they're trying to absolve themselves. This is research purposes only, and they know why you're buying it, but they're trying to cover themselves. So all over the site they have this as you're going through the site and trying to check out. Do not buy this, or do not inject this. This is for research purposes only, not meant for human consumption. That's a flag for me to stay away from it myself. But and it's no judgment from me on anyone that does it. Like my folks will say, what I eat don't make you shit. So if that's what you want to do, just try to do it in a safe manner.
Yep.
Yeah.
And
That's why I mentioned send it off to, at the very least, have it test for impurities, because it's very dangerous.
Yeah.
and as I look at the access, I mean, first of all, let me take the stance on I'm somebody who does not use gray market peptides, but I remember back when it had become a thing. So I know that access to medication is a complicated topic, and a lot of the gray market. I mean, people have been doing gray market for years, but a lot of the popularity started when there was an attack on compounds, and compounder was going to be going away or becoming more expensive or price people out. So, and then people monetized and all of that. But my stance on the gray market people, or anybody who goes to and decide to do or to use medications for their own, whatever their reasons are, I just think that they're in the GLP-1 space. We can be supportive of people and making sure that they try to be as healthy as they can and not have to agree with the methods that they use to do it. And if we are a community of making sure that we're taking care of each other, if we care about each other and making sure that we care about each other's health, is that more important than the means that they're using? So my stance on gray market is clear. However, I am certainly not going to absolve anybody who needs care, help, encouragement, or just somebody to listen to them as they talk about what has happened to them, because I believe that this community is one that's a community more so than a us versus them.
True.
Oh, for sure, for sure. I think Dariam, with that though, I think that's why I went to, if you're going to use it, right, because you have to, okay, but be honest about it, right? Be honest with your physician and let them know this is what I'm doing, so they can give you proper guidance, because that's what it is. And it's the same thing when I said, hey, I'm all about FDA regulation. I mean, some of that is just me being like, I manage a pharmacy, so some of that is in me. But at the same time, I know that people are going to use it because they're going to you got to meet people where they are. If that's where they are and they want to be healthy like everybody else, they're going to do it by any means necessary. And I don't blame them. But I'm just saying you have to be honest, because if you are going to use it and then lie about it and then start compounding it with other things on your own, you can truly hurt yourself. So that's why my stance is be honest with your doctors and be honest with the community, so the community could try to rally behind you and at least give you options.
Yeah, that's exactly where I was going. I didn't mean to sound like I was putting anybody down at all. I just, that honesty and openness with the doctor is just the main thing.
Yeah. Fully agree. Fully agree.
And I know I'm gonna start taking the peptide, but I got mine through a FDA approved like pharmacy, Cimarelin. So all my medical team knows about that and everything. So if you're gonna do it, I would say do your research, let your medical team know, like G said, and just make sure you're honest about stuff, because what if you're in an emergency room and can't speak for yourself, and if you haven't let nobody know what you're taking, they can pump you up with something and do some damage that you may not recover from. So definitely be open and honest about it if you're gonna do it.
Well, I'll be honest too. I asked my doctor about that NDA plus medication, supplement, peptide, whatever you want to call it. And I thought it was FDA approved. I really did. I was that ignorant on it. And so I ran it by her. She said, that's not even approved, Grant. I wouldn't recommend it. There you go. I mean, she blocked it real quick for me before I ever got too deep into it.
Yeah, it's a good topic though, RMZ, because it's really rampant, and it's picking up. It's picking up a lot of steam, all over the place, And my biggest fear is kind of like with the children. You know what I mean? It's not even so much about black, white, or about a race, but it's about the kids, because you got kids using it for aesthetic effects. They're not even necessarily suffering through obesity, but you got these young guys in the gym, and again, most know my son plays sports, and he's a athlete, and I'm seeing, children, utilizing things that, number one, they shouldn't be using at all, but definitely for aesthetics, and from the gray market, like you said, anybody can get it. You can just order it, and it's very scary at what this could actually turn into at some point.
True.
Agreed. All right, changing gears. That was a good topic. I'm sure we'll revisit that at some point. What do you guys think about the risk of underscreening for men?
So when it comes to the risk of underscreening, that it really opens you up to a lot of chronic illnesses or even conditions that could be handled quickly and be resolved quickly. And unfortunately, a lot of us don't even know what types of exams, tests, blood tests, or whatever that we should even be asking for to be able to know that what we're doing is going to be covered, or what are the ramifications for that. And if we are really reserved or reticent about going to the doctor, then we're putting ourselves and our family at a huge risk, because if something happens to us, that can that will definitely impact our families.
Agreed. Well stated. I'm gonna give y'all some numbers to have y'all think on it. The average life expectancy for men is 5 to 6 years shorter than women.
Mm-hmm.
About half of U.S. men do not get a yearly physical checkup. Check this out. I know a lot of men that don't like doing this, but 70% of men would rather do chores than go to the doctor.
Hmm.
And 65% say that they wait as long as possible to see a doctor, even with symptoms. Tough it out.
Yeah.
And around 20% admit that they haven't been completely honest with their doctors when they did go.
Yeah, I think it's a big bowl, because we just talked about that. The dishonesty with the physician, the fear. I think it's fear. I think it's fear and the financial literacy piece is missing too, because a lot of people are in fear that they can't afford the care that they're walking into. Especially, the insurance is a big deal. Like there are a lot of uninsured people, especially men, because you know it's a big conversation, but even with the economy, some people or a lot of people are taking jobs that don't offer benefits, and they're just trying to get the paycheck. So, a lot of it's contract work. It's not what you think. A lot of people think that the only way you aren't getting benefits is because you work under the table. There are a lot of nurses that don't have benefits, right? Because they're working via contract. So people like that don't want to go and deal with the bills. You got two sides. You got the people that's scared, there's fear, and then you got people that feel like they just simply can't afford it.
Right.
All of that. A few more things. More than half of men report not getting regular health screenings, even for major conditions like cancer or cardiovascular risks. And only about 28% meet federal guidelines for recommended physical activity. The three leading causes of death for men: heart disease, cancer, accidents, and unattended or unintentional injuries. And the first two can be taken care of with screenings.
A lot of this just depends on a person's perspective and what they've been through in their life. And, a lot of guys just don't think about how important this is until something happens either to someone in their lives or to themselves. And I can attest to this. My father died at 47. Not exactly sure how. I think it was a mixture between heart disease, diabetes, and smoking and all the above. But the heart disease is what spoke to me more about it. And I, at that point, I think I was about 28. I went ahead and had a cardiologist check me out, because I've talked to that side of the family, and heart disease and diabetes is genetic. And it's something that is present in that side of the family. So, that traumatic event for me started the process. Now, I didn't get perfect at 28. Obviously, I didn't really start till 40, but that process right there finally started it in the brain. Now, there was periods of denial, and ignoring and everything else we've talked about. But, I attribute a lot to what I finally buckled down and started doing to that experience and others in my life. So, I think a lot of men are fortunate and they've never had to face those kind of consequences, and it's easy for them to ignore and not go to the doctor too.
Yeah. I think a lot of it is wrapped up in masculinity. I'm just gonna tough it out.
True.
Or I don't have time. But I know specifically in the Black community, speaking to my family and friends, there are so many of them they just don't trust the system. A lot of them are ardent supporters of Dr. Sebi. They think that just eating a certain way is going to heal everything, so they don't need to go to the doctor. Drink alkaline water and do this or do that, eat whole foods, and you're going to cure your cancer. You're going to prevent HIV. You're going to prevent cardiovascular disease. And I think a lot of that is sold in the distrust that we've seen from the medical profession. Things like the Tuskegee experiment, Henrietta Lacks, A lot of those aspects of us being experimented on, those stories are passed down throughout generations, and as a result, many of us avoid going to the doctor until we have no other choice but to go to the doctor. And a lot of times it's we're going to the emergency room where those costs are going to be significantly higher if we don't have medical insurance. And sometimes even if you do have medical insurance, your deductible may be $5,000, so you're paying for the whole trip anyway.
True.
Yep. Yeah, I mean, my hope is that with the next generation, with the younger, I guess is what Generation Alpha is that what I think that's what it is. That we can sort of kind of change that narrative, you know what I mean? And some of that old thinking kind of dies off, and we can actually be, more healthy. And it starts with what we're doing tonight, right? I mean, we're a panel of guys that are in the know who are actually on the worldwide net, having this conversation. So I think it's happening. We just have to continue this, not let it be, such a one-off, you know what I mean? Like do things like this as regularly as possible in the hopes that not just us but the people in the chat, especially the ladies. We know that the GLP-1 communities are heavily populated by ladies, and what who has the most influence on the men? Women, right? So
True.
and I'm speaking from even with my other businesses, it's primarily women. It what I hope is that women have the stance that I'm going to be the influencer in my household, and attempt to encourage my significant other to take care of their health better along with the children. And I think that we can start to turn it around. At least that's the positive that I want to believe that will happen, and not take these hard stances on the past.
Geez, I agree with you 100%. But hopefully through these conversations, we learn to take accountability for our own health, so we could be there for the women in our lives and in our children, instead of being influenced by our significant other to go seek that care. We just take the bulls by the horn. Stop depending on your wife or your girlfriend to schedule your medical appointment for you. Go do that shit yourself.
For sure, but we're not.
Yeah.
I mean,
Yeah,
that's the
I know.
conversation.
Yeah, I know. Yeah, I know we're not.
We're
Yeah, I
not.
know we're not.
You know what I
I'm
mean?
just saying.
Like,
I'm
I
saying
hear
we got to
you,
get to
but
that. We got to get to that point. That's why I
yeah,
said 100% agree with you. The women have so much influence over the actions that we take, but we got to take ownership.
Absolutely.
And I think we're gonna get there, fellas. Because you look at us. How we have
absolutely,
grown
absolutely,
within the
absolutely.
last year ourselves. So we keep pounding, we keep talking, and keep having conversations like this. And I think it will change because we are pretty diverse dudes from different backgrounds, and
Yep.
we touch a lot of people in our circles, and I think that's really going to have that reach one, teach one mentality that we're gonna really just get to that point. And I think when we celebrate our wins, that goes a long way. Because what happens is, our GLP-1 female families, they brag about us all the time. They're like, hey, RMZ did this, G's did this, Grant did this, Dariam did this. They brag on us. And you know what happens? Dudes be like, who are them dudes? I'm jealous. I want to be like them. So how we are
Yeah.
sometimes. So I
Yeah.
think
You
I
actually
think
right,
that's good.
Paul. And I actually want to take a step back because that was a little tangent there. And I actually try not to do that because I do think we don't give ourselves enough credit. We get so bogged down in who's not doing it. We're not talking about us, right? You got a panel of brothers right here, that are doing it. You know what I mean? So we can't necessarily just sit back and just focus on the people that's not. Let's focus on the people that are like us and celebrate that. So yeah, big ups to the guys like us that are doing it because there are guys that are on it, too. So
100.
Absolutely.
100.
Absolutely.
All right, so that's a perfect segue into the next question. How do we talk to other men without preaching? I think Grant mentioned this earlier.
Sorry about that. I got a little ahead.
Hey, I'm gonna say this, man. I like keeping it a buck with people. I'm gonna preach to them. If they don't they don't like it, that's on them. You know, I'm
I'm right
gonna
there
be
with you, Paul.
I'm gonna be
I
unapologetic
don't
who I
care.
am. You know what I mean? So it's like if you're gonna be that much of a chump that you ain't gonna listen to me because I'm preaching to you,
Next,
that's you, player.
next, because I'm gonna keep doing it. You're right. I'm right there with you, bro.
But the important thing is you preach it, but you follow through by doing it too.
Yeah.
Yep.
Absolutely.
Yeah.
Absolutely. Great point, Grant. They can see us. Not only are we talking the talk, but we walking that walk too.
Yep.
Dariam, you have a way with words. What you think?
Well, see, me, I'm not preaching because I would rather be the example of what I did versus what you should do. Because I don't know your entire circumstance.
Yeah.
I don't know what happened to you, what got you to where you are. I could just tell you who I was. I remember, Geez, you said something that really made me do some introspection. You said that we should not be lying to the doctors about what are the things that we're doing. I think the biggest hurdle for me was I spent years lying to myself. So how am I going to tell a doctor what I'm doing if I'm lying to me about how I'm feeling? I'm toughing it out and I'm doing these things. And oh yeah, we all hear the things that you should be doing, but it's in one ear and out the other because a lot of times you're more touted for your successes than your struggles. So people will say, "Oh yeah, you should go to the doctor, but we got to pay that bill. We got to do this, all these things." Oh yeah, I know that you got to go to the doctor, but how are we going to do so and such and such? So yeah, you'll have the support for doing those things, but there's always something else. So I'm with you 100% on you have to have the self accountability because a support system is fantastic, but a support system is not compliance. So you have to say, "I'm going to do this for me." When it comes to sharing your stories, and I think that is a lot more impact of people sharing their stories that make more of an impact than you preaching at somebody.
Yeah.
Because like Grant said earlier, if you're preaching at somebody, they're going to shut down. But your message is more powerful by sharing what you've been through and what you've experienced than telling somebody what you should do. That's just my view of the world.
Well, you know, here's my thing. Like, if it's like one of my guys who I love dearly, and if I see he about to get hit by a Mack truck, I'm gonna say, dude, move out the way before you get smacked by that truck. You know what I mean?
Right.
So, and if I didn't say anything, then I'm gonna feel bad because I'm like, if I would have just shouted from the rooftop, "Get out the way, player! You about to get hit," then maybe he'll be alive. But I will say this: I'm not gonna tell you 5 or 10 times. You know what I mean? I'm gonna tell you
Right.
maybe a
I
couple of
think because
times.
we're on the internet. Let me be clear. I need to be clear because right. So I think that I understand perfectly, Paul. I think people might have misunderstood where we were coming from when we say preach. Because I'm not the guy that's going to be out in the streets, you know, like trying to wrangle people down. When I say that, I'm only preaching about things that I am the example of. That's what I
Right.
mean. I've already shown it because you see the pictures, right? A picture's worth 1,000 words. So
Yep.
if you see me, I'm not preaching to nobody about nothing that I haven't done. I'm only saying I'm
Absolutely.
going to offer advice to people based on what they seen me do. That's what I mean. Not just randomly preaching to people about
Yeah,
everything because I'm not that type of guy anyway.
absolutely.
Right.
Yeah, absolutely.
I kind of split the difference. I think you got to know who you're talking to
Mm-hmm.
True.
and deliver the message in a way that they'll receive it. Like I had a position coach in college, and he knew how to reach each one of his players. Like me, he would chew me out because he knew that would motivate me. With someone else, he might pull to the side and whisper in their ear and say, you know, you need to do this, you need to do that. Me, he would cuss me out in front of everybody because he knew that would set me off. And me being a leader, he wanted me to set an example. So you got to know who you're talking to in order to deliver that message. Some people, you give it to them hard. Some people just pull them to the side and say, hey, man, this is what you got to do. You need to take your health seriously. But so I come at it both ways.
But that's
But you,
spoken
but
like
you
a
know,
true
When
90s athlete. That's a
Yeah.
90s athlete. Today's
Yeah.
athlete, you can't do
You know what?
that. You get sued.
Don't
Yeah.
hit the
Well, see, the
transfer
thing
portal.
is,
That's a
Yeah.
90s
And,
I
athlete.
remember I remember
yeah. And
growing up in the city, and one of the things that we were very fearful of were strangers or people we didn't know or people we didn't have no relationship with. So if you're telling me get out the way for the bus because a bus is coming, I'm not listening to you because I don't know you. So I'm going to not pay you any attention. But if I, but you know, but if I have a relationship or I built a trust in you, or if I say, oh, well, yeah, that Paul, he's amazing, or whatever, then whatever Paul is telling me, I know he's coming from a good place. There's a lot of noise in these communities. There's a lot of people barking
Mhm.
in these communities. There's a lot of people who are selling a lot of stuff in this
Mhm.
community. And can you
Yeah.
listen to everything? No.
No.
But if I can say to you or build a relationship with you or get even a familiarity that you're coming from a place that resonates with me, I may be more apt to hearing what you have to say than just some, because there's a lot of noise. People got, everybody knows how to cure what you're going through better than you ever did on the
Yeah.
internet.
And Darian,
So
that
I
is a,
say,
yeah, that's a great point, Darian. And to kind of go along with that, okay, here I come. Here I am telling you, get out of the bus, get away from the bus. Another person's come around with you and say, get away from that bus. Another person, so you got 10 people telling you to get away from that bus because you go get hit. Then you might think about, well, maybe that dude Paul did know what he was talking about. But I do agree. The
Yeah.
more people know us, the more apt they're going to listen to us. And like RMZ said, in every instance, RMZ, that you use, somebody got some direction, just the way that it came across, a different person. So it's not like you're not telling someone or helping someone out. It's knowing who you're talking to and see how they're going to receive. But that coach did take a step and talk to every one of those players.
Yep.
But some just responded a little bit different.
Yep.
Yeah.
And another thing to consider when you're trying to deliver your message in person or this way is try to concentrate on the good. There's so many out there concentrating on the bad effects, the bad of all it. You got to concentrate on the good that comes out of it, and that speaks to what we've already said. Just living by example, showing our story, and so I mean that's something that was brought out in another video I was watching the other day. It's just you gotta bring out the good of it, and not just preach the bad and what could bad happen.
Hey, RMZ,
Yeah, I mean,
can you show Bellflower's comment? Because I mean, Bellflower put it up. She like put it down. I'm sorry about that, G's. I didn't mean to cut you off, bro. I just saw Bellflower's comment, and that one is like she just put it down.
Mm-hmm.
Yeah. That's so true.
yeah, that's true. Um, no, I think I was going to say, Grant's right. You definitely want to focus on, some of those positives there, to make sure that, that positive reinforcement. But I think everything in communication, I mean, I think everything matters. You know what I mean? Like it all matters. There's no wrong answer.
True.
The important part is to be respectful and receive
Mhm.
information that's coming to you, whether you agree or disagree, and you can do with it what you may, because now today you got people that record murders.
Yeah.
Okay. I mean,
Yeah,
so you got people that don't care what's going on with you. You know what I mean? So
yeah,
just be happy that somebody's willing to, you know what I mean, just
True.
get involved, because now people can get murdered right in front of a person, and they're still, you just wonder, like, you actually recording this. People are dying in front of
yeah,
you and you're recording it instead of actually utilizing the phone for emergency services. So
yeah.
you got to look at where we are, and with where we are, you got to, like, respect that somebody is even attempting to help you, because people don't.
True.
Mhm.
Great discussion. All right, last topic: mental health. This is something that surprised me, and I want to talk about mental health because we talk about all these other aspects, but this is one of the most important things for us as men. This statistic surprised me. I did not know this. Men die by suicide about 4 times more than women do. Despite high risk, men are less frequently diagnosed or treated for mood disorders because they are less likely to seek help. And that surprised me. But the number surprised me, but when I thought about it, it didn't really surprise me because we live in a world where we try to fit society's view of what masculinity is. And if we fail at living up to what that definition of masculinity is, then we feel hope is lost and there's nothing to live for. So I think it's real important for us to do something to address our mental health, whether that's speaking to a professional, have some kind of outlet or something. We got to learn to talk instead of bottling it up and letting it fester. What are you guys' thoughts on that?
Yeah, Kim J was kind of talking a little bit about this for this live. Self-worth is so important. Knowing that you're important, and in doing that, you have to express your emotions to keep that self-worth in check. And that's so much easier said than done. So much easier. But I read a lot of Dariam's Substacks, and this he goes straight to this a lot of times. You just got to remember to keep your inner self healthy and not get bottled up and go in your own world and not come out.
Agreed.
It kind of reminds me, RMZ, what Beast Mode said a few years ago. Remember, he's talking about guys getting their chicken, but he's also said, make sure your mentals is good.
Yeah.
Because mentally, I mean, we can go through a pendulum of emotion, especially when we get a little older and that testosterone starting to go down some, and we're not feeling confident about ourselves, and things are going on externally, internally, and we really don't know where to turn. For some reason, us men folk think it's a sign of weakness when we ask if we need help. I mean, if we're struggling with our mentals, call up our guys, call up our homies, and be like, "Yo, man, how you doing?" You ain't even got to tell them something is wrong. Just chop it up. Just have a conversation with people. And again, like Jeeves was talking about, we being on here can amplify this message of it's okay to ask for help. It's okay to cry. It's okay to feel down. I mean, we're human. We're not superhuman. There's only one perfect man that walked this earth and did it the right way. And ain't none of us them. None of us him. And so that's why we got to just realize we're not human. It's okay to show emotion and okay to ask for help.
Yeah. Black Disney Dad just posted that. That's sad, man.
Yeah, it is.
Yeah.
For sure. Charles, I think this is a full circle moment because, if for those of you that were around then, if you can remember our first roundtable, we kind of like really dove into mental health, right? And we kind of talked about us men having that mentality of when people checking on us, just using that "I'm all right," word. People say, "How are you?" "I'm all right," and you're really not. And it's still something that we all have to deal with because, like you said, the same thing applies with healthcare. It's the tough it out mentality, and we really got to stop doing that. And again, same thing. The more we talk about this, the more it might make people comfortable to actually say something. If you need help, reach out. You don't have to, feel like, I feel like mental health, has a stigma that it shouldn't because the brain is an organ, just like anything else, and it can get sick, right? So there are medications that can help, and we should not feel ashamed for asking for help because that's also a part of our body. Just like we all want to get thin, get fit, and be healthy. Without that, nothing really works because truth be told, even this GLP-1 community, it all starts in the mind, right? It's a brain drug at the end of the day. So we're already doing it. So what's one more? If you need something, and it might always be a treatment. It could just be counseling or therapy. So if you're a guy, listening to this video and you're kind of at that place, feel free to reach out to anybody on here. I'm sure a small conversation, is always available to you if you're struggling.
Absolutely.
Absolutely.
And me, I'm a really, really, really big proponent for seeking mental health.
Mhm.
As somebody who has spent a lot of my life appearing to be the person who had it all together, I was dying inside from performing. I was performing to be perfect. I was performing to do everything that I was told. I was performing to make sure that I took care of everything else. And I put me on the back burner. And when I was diagnosed with this chronic illness, it was like my deck of cards or my house of cards fell on top of me. And I realized that I needed help. I did not have it all together, and I was tired of lying about it. And I had to find somebody who was there to help me that was in the medical field because I did not want to trauma dump all of this on my friends and family who would be, oh, really, really, oh, petting you, but they're not able to give you the help that you needed. And finding an outlet for somebody that you can be 100% real and raw with, and just like finding the right doctor, finding the right therapist is very important. But to help you to be able to unload a lot of this and give you tools that will help you with living a more fulfilled life, knowing that you can do this, that there are outlets, that it's okay. But also, when you're doing it and you become exposed, how do you handle being exposed? How do you recover? Well, how do you build your resilience? And it's just one day at a time. So I'm a big advocate for finding help, finding treatment, just trying to get somebody who can help you with figuring it all out. Because if I had it all together, I wouldn't need anybody to help me out.
Mm-hmm.
So I'm a big proponent for that. So if you are somebody who just doesn't want to be a burden on somebody else, there are professionals who can help you with unburdening yourself to be able to help you get to where you're trying to go.
Mm-hmm.
Absolutely.
Well said. Well said.
We definitely got to break the stigma, not just with men or black men, but the black community as a whole. I know I'm a PK. My dad's a pastor. I grew up in the church, and there's a mentality within the church. You're just gonna pray it away. You can pray about it, but you still got to have some professional help, seek some guidance. Great discussion, fellas. This was fun. I didn't realize we almost an hour 30 minutes in already.
Didn't even recognize it.
Love hanging out with y'all. Now we're gonna move
Absolutely.
to Q&A if we got any questions. Got one from the incomparable Mel B. Thank you for the super chat. Appreciate you. If you could go back and talk to the version of yourself before starting GLP-1s, what hard truth would you tell him, the one he probably wouldn't want to hear?
Do you want to be
I
around for
would
your
tell
family? I mean, what are you doing? You're cutting years off your life. Do you want to be here to support your family, be here for friends, be here to do what God put you here to do? Or are you just going to kill yourself? Sorry, go ahead.
no, you're good. I would have told the young me, you matter.
Yeah.
I would tell the young me, I'm sorry. Sorry I didn't do this sooner. Sorry that I took years off of your life by not focusing and being serious about what I was doing to my body and how many things I wasn't able to do anymore. That's what I would say.
I would say it's okay. You didn't know what you didn't know, and now that you do know, you're doing what it is that you're supposed to. So it's okay.
I think the one thing I would tell myself, and I mentioned this before, I had to think about this, and I mentioned this before, is I would tell myself to stop hiding. I didn't I didn't realize I was hiding until I wasn't hiding any longer. I didn't realize that I lost confidence that I had in myself until I started shedding the exterior, and I can see that confidence coming back. Um, that's a tough question, Mel. That's a good one. Ooh, you tough.
That's why she's Mel to the B.
Yeah.
She'll be messing around.
Let's see. All right. Grace. How long have you been on a GLP-1? What is your current dose, and how much weight have you lost so far?
I'll go first. I've been on the GLP-1 since March 9th, 2024. My current dose is 15 milligrams of Mounjaro. I've lost 31 pounds so far.
Nice.
Awesome.
Nice. Good job, Darren.
Good job, Darian.
That's awesome, Dariam.
Yes,
Awesome.
it is. Well, I've been on Mounjaro. I started January 19th of 25, and I'm currently on 12.5 milligrams, trying to stretch this out as long as I can before I hit 15. And I've lost 75 pounds as of this week.
Congrats, Grant.
Good job.
Yes,
Good
amazing,
job.
man. Absolutely
That's awesome.
amazing.
Thank you.
Huge.
That's awesome.
I've been on the GLP-1 February 14th, 2025. Currently on 10 milligrams. And how much weight did I lost? I just dropped this video, so y'all go watch it, and then that'll let you know how much I lost. No, but I tell you what, if you promise to watch it, I'll tell you how much weight I lost. Okay, let's go watch the video. So
Don't spoil it. Make them watch.
Okay,
Make them watch.
okay, good job.
Don't tell
All
them.
right, King, I'm gonna do that.
You
Tell
got
them to like and subscribe.
your Zeppiversary's coming up, man.
Yep, coming up on
Saturday.
On Saturday.
Yeah.
Okay, good. Well, yeah, go ahead and withhold that, man, so we can come celebrate with you. So
All right, sounds good.
yeah, so I am on 12.5. I've been on the GLP-1 for I think 57 since January 5th of 2025, and I'm down 93 pounds.
That's awesome.
Congrats.
Congratulations.
Thank you.
Wow.
All right, me, I've been on my journey for 2 years and a month, and I am on 10 milligram dose, and as of this morning, I am down 120.
Nice.
Nice.
Thank you.
Amazing.
And I just want to say this: when we all started our journey, Charles, you might have been on your journey already, but Darian, you were there at the beginning for my journey. I believe maybe even G's too, and Grant. I'm not sure. I don't want to speak for yourself, but
Around there.
Darian was the first cat who reached out to me when I was on this journey. You remember how scared I was, Darian, when we was on Simply Taisha's live stream? How scared I was, man. And you just was like, "It's gonna be all right. It's gonna be all right. It's gonna be all right." So Darian, we appreciate you. You
Yes.
are just an amazing person on this journey. Thank you, brother.
Dariam is everyone's intro to the community. That
Yep.
brother is the welcoming committee. I love it.
And continued support every day.
Absolutely.
Yeah.
Darren's the man.
All right. Well, there were two questions that were submitted to Dariam from his Substack. And I'm going to ask these. How can significant people in your life support you on your health and wellness journey?
Charles, what was the question again? I'm sorry, I was drinking water and I swallowed too hard. I'm sorry.
You got that surround sound swallow, huh?
Yeah, Joe, I'm sorry about that.
How can significant people in your life support you on your health and wellness journey?
I would say I'm fortunate because Rainy Days, my wife, she supports me because she started a week after me, and she was the one that wanted help before I even knew I was going to get some help. So she and I doing this together, it makes it easy because we keep each other accountable. We have this little thing that we do, and that is we make sure that when we are eating away from home, that we still stick to the principles of the GLP-1, meaning that if it's not as healthy as it should be, that we share it, that we make sure when we're out of town for work, that we go and work out, we keep our same routine, and it's nice to have an accountability partner that can keep you in check when you're thinking about veering off.
Absolutely. You know, my wife was a lot of the inspiration for me too. I mean, she was on her journey, which she's not on GLP-1, but she took it upon herself to start just dieting and all that stuff and being so hard on it. And you know, there was many a time I think it would have made her journey a lot easier if I was already on that same page with her. But in the same time, she didn't preach to me, but she showed me. And then when I finally got to the point where I was ready, she is actually the one that suggested I ask about a GLP-1. She said, Grant, with your diabetes and all and your health, I think you need to ask about this. So, you know, that was such an important step for me, and having that significant other. And, you know, I'm thankful that, you know, she was patient with me, and it wasn't something she said, well, forget you, you know. she was very, very inspirational and supportive of me even before I realized I needed to do this.
That's cool.
I would say, I mean, a lot of people know, they see my wife in the chat a lot of times when I'm doing my videos. You know, she's super supportive. She's on a journey now too. We actually have a live coming up this weekend for Valentine's Day. We're doing a couples live. It'll be my first interview of somebody. So I'm starting with her, and she is doing amazing. She's already lost probably about 15% of her body weight, and she's just been on the journey for about 5 months. So she's doing amazing, and she's kicking behind.
That's awesome.
Awesome.
And I would say for me is just kind, encouraging words keep me focused and motivated. I generally have the mindset that I'm going to do it anyway, but that just gives me that extra push to keep going. So I can say, hey, I'm sexy now, type thing. So love it.
Well, Charles, you know what I say, right? Even when I was almost 400 pounds.
Always sexy. Big
always
sexy. Big sexy.
Yep, big sexy.
All right, and it's another question, and these questions are from Beautiful I Am Colored. So her next question was, how important is it that your partner prioritizes health and wellness? If they are not, is it a turn off, deal breaker?
What was the question again? I don't think I was in the chat.
How important is it that your partner prioritizes health and wellness? If they are not, is it a turnoff or deal breaker?
Oh, uh, obviously it's important, but it's a touchy subject, obviously because we all know, just especially, women may struggle with a lot of hormonal issues that could cause, weight gain a lot different than men. So that's a touchy subject. I think a little bit more so with men than probably with women, maybe. You know what I mean? I don't want to speak for women, but at least for us, from a male perspective, you got to be very careful at how you approach that, because above all else, it should be about health first. Then maybe the other physical attraction things. Of course, it matters, but at the same time, you probably should walk a fine line with that, but obviously keep their health top of mind, lead with health, and be an example, like we talked about earlier. Because we talked about preaching to strangers, but it's all in the delivery. What is the message when you talk, especially talking to your significant other? And if you've been with them for a long time, I mean, me and my wife been together for married 19 years and together over 20, so I know her really well, so I kind of know how to approach things. But if you're newer, that can go bad really fast if you don't know what
Oh
you're
yeah.
doing.
Yeah, if you're gonna have that conversation, you better have some skin in the game for a while.
That's right.
But
Yeah.
your significant other, if not, you're gonna find yourself by yourself.
Yep.
Well, we were both pretty large when we first got married, and you know, and I ain't just saying this to get on her good side. I mean it. I mean, she's always been beautiful from that perspective, and it is now. And I don't care how healthy we were. I wouldn't let that be a deal breaker at all, because the relationship's a journey in everything. And this is one of those examples, is your health, and you just gotta stick with each other and encourage each other at whatever point you're at.
Love it. Love it. All right. There's one more question from Grace. Beyond simply saying don't compare, what practical strategies do you recommend for people who feel frustrated that their results aren't fast and furious? Come on, messy middle.
No,
You got the word on this.
I was trying to give people a chance to talk, because I'll get in and I just start rattling off. I'm trying to be. I got a panel here.
This is what your Substack is about.
Look, this is my life right here. This is what I live for.
But Dariam didn't say anything about the significant other. So Dariam, you gonna talk about that? Significant other?
Look, back to the question on the board. The board says about what do you do instead of don't compare, because comparison. I think comparison is very normal. What are you going to do with it? So what are you going to do when you compare? But if your strategy of Fast and Furious is not working, it's time to do something else. Mm-hmm. So your measure is not going to be losing weight fast, if that's what you're trying to do. So what other health markers can you work on? What else can you focus on? And what plans can you be in place with that? Another thing, what kind of care team do you have? Now, I'm not a big proponent for firing one doctor. I'm a big proponent for adding to your care team. You can have more than one doctor on there, because you may have a PCP or your primary care physician who is fantastic at making sure that you don't have strep throat. You may need somebody else who's going to help you with your obesity, and somebody else who may help you with your diabetes, or somebody else may help you with any other thing that you're going through. But if you have because finding recommendations from strangers on the internet who don't know your entire medical makeup is only going to frustrate you more, because there could be underlying conditions that need attention first. So those conditions, or if those things are resolved first, the other, the weight loss or whatever the other things may get in line once these other things are going on. So for strategizing, if Plan A is not working, what is Plan B? What is it that you're focusing on? Then do you need to expand that? Do you need to figure out other therapies? What else can you do? And getting a game plan may be part of that particular strategy. Yeah, I could say, oh, you just be happy with your life and just pray that every day is better than the next day and every rain is great for every sunshine. But that ain't some people's story. Some people just mad. And that's all right to be mad. That's part of being human. But what you gonna do with the mad? You got to do something. So,
Well,
Yeah,
kind of
yeah.
to answer the last part of that question, you got to remember there's a lot of results to look at. I mean, it's not just weight loss.
You
And
stole my thunder, Grant. You stole my thunder. You stole my thunder,
and,
man.
and it's kind of on the same
what you
theme as
mean
I
it's not
said
just
earlier.
weight loss? What you talking about?
I know, man. That scale, you don't need to listen to it. Don't let it get in your brain. Easier said than done, as I've already said too. But you got to look at the results of how you feel. Hey, I'm down 5 pounds, but boy, I feel a lot better. Yeah, I need to lose another, 50, 60, but right now I feel great. These are great results. I feel good. And, not having to be on a CPAP machine no more. Man, that's great. Oh, yeah, I know I'm still a little heavier, but don't concentrate on that. And so,
Yeah, I mean that before Grant had started, I was gonna say, do you know where you stand, right? Because a lot of people just jump on the scale, jump off the scale, and that's not really the story, right? Do you know what your body fat percentage is? What's the difference from where you started to where you are? You know what I mean? Are you looking at your habits? Are you looking at your clothing? Are you looking at the inches? Are you look? I mean, I can keep going. It's so many things other than just the scale. Are we looking at percentage or are we just looking at the weight, right? So that's the thing. A lot of people have already superseded the 20% that they were promised and they're looking for more, right? And then they're saying that they're not fast and furious. So the question is loaded because that's the thing. Do you know where you really stand? What is your percentage? And have you superseded what the medication said it would do for you already anyway?
And I would say this, and I agree with everyone. Everyone said I couldn't say it better myself. I'll come at it a little different angle. To me, Grays is a textbook example of what to do if you're kind of frustrated where you're at. And each person has to make their own pivot. I look at Grays as a journey. Because she and I, we used to call ourselves twins all the time. Now we're triplets because losing to Amy, we're around the same time that we've been in these GLP-1 streets together. But I remember when Grays was struggling, and Grays tried to pivot, do certain things. She focused her mind on certain things, and then she found something that worked for her, and that was kind of like the protein ratio, and also making sure understanding that caloric deficit. All of us have to find out what are we going to be happy with? Are we going to be happy with and pleased with that our clothes is fitting better? Then look at that. Look at that win. Are we going to be happy that our A1C went down from 5.9 to 5.1? That's a win. If we have the body comp scales, if our body percentage is going down, if our muscle mass is going up, whenever we go to work, people are like, hey, you're looking good. Look at you. You slimming down. Stack these little wins up. You stack these little wins up, then you go win the championship. So don't be too hard on yourself and be honest with yourself too. If you stuck, find out the reason why. Is it because maybe you're not following, what you should be following with your eating plan? And if you're okay with that, then be okay with it. But don't lie to yourself. Don't try to fool yourself. If you really want the results that are trying to achieve, be honest with yourself and stick to it. But if not, if you cool with the way you act, the way you feel, by all means, don't compare yourself with anybody. But that's just my opinion on it.
Y'all brought it home. With that, we're gonna wrap. Each of these gentlemen, you can find if you're not following them, you can find their social media addresses in the description of this video. My man Grant just started a new YouTube channel, so please hit that description down there and subscribe to his channel. He will be making more content there and hopes to go live soon. So please make sure that you subscribe. Gentlemen, I want to thank you for tonight. It was a great conversation. I think we need to do this more often. Time went by fast.
Sure.
Before we get out of here, though, I just want to reiterate prostate cancer. Please go get your PSA tested. It's just a simple blood test. Generally start screening at 50. Unless you are a black male, you should start at 45. And then if you have a family history where either your brother or your dad has had prostate cancer, you should probably start at 40 to get that baseline. And as a reminder, black men are 80% more likely to get prostate cancer. So it's very important that any black man out there, well, it's important for all of us, but it's important for black men because we're 80% more likely to get it, to go get that PSA test. And we're twice as likely to die from it because we get it when it's too late. And by the time we get to it, it's already metastasized into our bones and our organs. Colon screening. Prostate cancer is the second leading cause of death in men. Colon cancer is the third leading cause of death. Start at 45 or earlier if you have a family history. Men are diagnosed younger and more likely to die from it. Screenings reduce mortality by up to 60%. So please go take care of both those screenings. With that, a reminder, I won't be here next week, but the week after, we start back with a new round of one-on-one interviews. Thank you all for coming out tonight, and I appreciate you. Have a great week, and happy Valentine's Day. Hope you have a sweetheart to take out or to take you out. And G's will be doing a live on Valentine's Day with him and his wife, so please check that out. And
Sunday, not Valentine's Day, Sunday.
Oh, Sunday the 15th. Okay, Sunday the 15th. Yes. And please go check out Paul's weight loss video. Don't forget that. If you want to know how much weight he lost, check that out. And Dariam's over at Substack. All that can be found in the description. Thank you. Have a good night.
Good night.
Good night, everybody.